Call upon Mr. LaHood to be recognized.
Thank you, Chairman Neal and Ranking Member Brady, for having this hearing today. And I want to thank all the witnesses today for your valuable testimony. And Ms. Wood, thank you for sharing your personal story with your daughter and your passion. Appreciate that very much. I think it's an important part of this debate. And I've enjoyed this debate here today in looking at this proposal of Medicare for All and the different dynamics and how we as policymakers digest that and think about what we can do differently or how we can do things differently. And as I listen to it, I think about how are we going to pay for this? And that's the thing that foundationally keeps coming back. We're $22 trillion in debt. And when I go back to my constituents in central and west central Illinois, hardworking people that play by the rules, but they fiscally ask, where are we coming up with the money to do this? And the fact, if we look over the last 10 years, we've gone from about $9 trillion to $22 trillion. The vast majority of that under the last administration. So we haven't had a good track record of being fiscally responsible in Washington, D.C. So to think about this proposal or a variation of these proposals of the government's going to take over health care and how that's going to work, it's frustrating to try to digest that and go through that. And so foundationally, I'm not convinced, and I think there's a lot of people that are dubious and skeptical of how you do that with a track record that hasn't worked with the government being involved. So I'll just say that foundationally. I want to pivot a little bit. This has come up throughout the hearing today. I represent a rural district, central, west central Illinois, and access to health care services are already a challenge in rural America. The health needs of rural America are very different from those living in urban settings. We know that. The ability to travel to care or have access to specialty providers is very different for those living in rural areas compared to urban settings. A one-size-fits-all model does not allow for consideration of the unique needs of rural communities, and that will hurt rural America. In my district, 9 of the 11 hospitals I represent are either critical access or sole community hospitals. These hospitals fight every day to keep the doors open to patients. And without these hospitals, many of my constituents would be hours away from care. One hospital in my district has 70% of their operations supported by the Medicare patients they serve. A transition to Medicare for All system would mean that they could not sustain operations if they had to operate 100% on the one-size-fits-all payment system without the support of the private market. This would leave their communities without a sole community hospital. To add to this overarching concern of rural hospital closures, one provision of the leading single-payer bill in the House that I want to point out would further harm the providers that could manage to stay open. Under this Medicare for All bill, the government would control the hospitals, their finances, and their ability to renovate and secure new technology. Funding would come from a capped global budget, and no funding is guaranteed for capital expenditures. All funding must be approved by an unelected bureaucrat known as a regional director under the Secretary of HHS. Institutional providers like hospitals would be prohibited from using any funds in a lump sum they receive from the federal government for capital expenditures, including renovations and facility upgrades necessary to improve patient care. Instead, they would have to apply for or plead their case to the government for approval of funds, simply to renovate their facility to improve care for patients. So if my hospital doesn't qualify according to whatever standards the Secretary of HHS decides to set, or maybe it doesn't qualify, but the Secretary of HHS and its regional director denies the request for funding, a community will be left to perish with no way to renovate or expand their facility in order to make improvements and properly care for their patients. And that's a concern to me. Ms. Turner, is it correct that under the Medicare for All, healthcare providers and their local community of patients in need would be left to the mercy of Washington bureaucrats?
As you say, in Congresswoman Jayapal's bill, it does explicitly say that hospitals would have to petition Washington in order to be able to make capital improvements to their hospitals. I think that's really indicative of the Mother May I approach that people really want to move away from. They want to be empowered themselves, have efficiency, as Dr. Berwick said, comes from the bottom. Efficiency comes from people on the ground knowing what's needed and being able to have the resources and allocate those resources appropriately and proper incentives to make sure efficiencies are gained in the system. There's plenty of room to be gained in our healthcare system to wring out waste and inefficiency. But much of that is driven by people trying to follow the rules rather than trying to figure out what's right.
Thank you. Yield back.